Wash your hands with soap and warm water. Then, rub and shake your hands to activate blood circulation to your fingers. Remove all items from the package and place them on a flat surface. Place the microtube on a flat surface. Clean the outer edge of the middle or ring finger of your non-dominant hand with an alcohol wipe and allow it to dry for 20 to 30 seconds. Twist the cap of the lancet and press the small tip into the side of your finger until the needle clicks. Make sure to wipe out the first drop of blood with the provided gauze. Gently massage the entire length of your finger to form a large hanging blood drop. Position the finger over the microtube. Keep dropping blood until the tube is completely filled. Gently press the gauze pad to stop the bleeding and apply the bandage. Next, remove the bottom red cap and place it on top of the vial and secure the cap by pressing down until you hear a click. Place the sample in the clear biohazard bag and seal it. Place the sealed biohazard bag in the mailing bag. Place the prepaid return label on the mailing bag and ship it within 24 hours of collecting the sample. Thank you for watching the instructions of capillary blood collection.